Hey guys, welcome back to the channel. So today's video is kind of aimed towards like my newer grads or people that are in fieldwork, students that are going to be taking on like a hand therapy, like a hand therapy fieldwork experience, or you've graduated and you're going to be starting a job in a hand therapy clinic. So I was thinking back to when I was going through my hand therapy fieldwork and trying to figure out like things that would have been helpful for me when I was at that age and stage in my education. So today I kind of want to just talk through how to do an initial evaluation for a hand therapy patient, because it's something that you don't really learn in school, and I feel like it's, step one of creating an appropriate and effective treatment plan. Like if you don't do a good evaluation, you're not going to know how to treat your patient. So that's what we're doing today. Should be an interesting video, a lot of me rambling on, so that's always a good time. So if nothing else, stick around for that. Don't forget to hit the thumbs up button, subscribe to the channel, and let's get into it. So I think the first kind of important thing to talk about is the amount of time that you're going to spend on your first initial evaluation. So every clinic is different, the way that they schedule initial evaluations. In the clinic that I work in, we have therapy techs, so each therapist has a tech or an aide that helps out treating their other patients. They follow any orders essentially that I give them. Anything that I tell them to do, they'll do with my patients. So in our clinic, initial evaluations are actually booked in 30-minute slots, so sometimes that is definitely a challenge. Sorry. So sometimes that is definitely a challenge. There can be times when, either I'm running late with one of my other patients, or I don't get to spend enough time with one of my other patients because I have this initial evaluation coming in. But I just wanted to give you some, kind of tips and strategies based on where I'm coming from. So typically for an initial evaluation, the person that I'm evaluating is usually in the clinic start to finish probably 45 minutes to an hour. That is for non-post-op patients. So in our clinic, it's a little bit streamlined in terms of post-op. So because I work for a surgeon directly, post-op evaluations are handled a little bit differently. So today we're just kind of talking about non-post-op evaluations or evaluations coming from another doctor. Yeah, whew. We're gonna have a lot of words. Anyway, about an hour is how long that my initial evals are in the clinic. So I think in regards to time, what I'm trying to get at is that you are with this person for a limited amount of time on your first treatment session with them. So you want to gather as much information as possible, but you also want to take into account what's really important. So you really have to think through, do I need to do all these different measures? Do I need to go through a full manual muscle test? Do I need to do some of the standardized assessments? Do I need to do sensory testing full out this treatment? So you have to kind of prioritize, like, what is the most important things for you to get to this day, and what can you wait to assess until next time? Because really truly, hand therapy treatment and all good therapy treatments should be a continual assessment. Every time you see the patient, you're assessing them. So if you don't get to everything on your initial eval, it's not the end of the world, and you shouldn't panic about that, because you'll see them again in most cases, right? You're going to see that patient again. You can always do additional measurements, or if you need to do standardized testing or anything like that, you can wait until a later time. So get to the point, listen to your patient, and figure out what's the most important things for you to assess in the short amount of time that you have with them on that first visit. What I like to start with in my evals are trying to just open up dialogue and get the person to talk to me, tell me what's going on. So something that I'll usually say is, tell me a little bit about your injury. Tell me a little bit about why you're here today, and kind of go from there. And some people will open up to you and they'll tell you every little detail, and some people you'll have to kind of ask a few follow-up questions. So essentially you want to know what their injury is to them, right? So not necessarily just the diagnosis from the doctor, but have them describe it to you. When did it start? Was it a traumatic incident or an accident? Was it just over time they noticed something started to happen? When does it bother them the most? Are they feeling it during the daytime? Is it when they first wake up in the morning? Does it get worse throughout the day? Is it something that they notice most at nighttime? Try and figure out kind of any factors, like what makes it worse, what makes it better. All these kinds of things are really important to know, and really truly take this time to let the person talk. Let them tell you what they've been feeling. Let them describe what it feels like, because what they're telling you is important, and they're going to tell you within those first few minutes what you need to be treating. So listen to the words that they say. Watch their actions. Are they guarded when they're moving? Are they, kind of protecting themselves? Do they seem like they're really tense? Do they seem like they're exaggerating things? Just notice every little thing that you can. How do they position themselves? How do they show you where it hurts? Do they touch it? Do they brush over it without touching it? All those little things are important details. So you need to really listen to them and observe them, because every second that you spend with them is really valuable. So make sure you get a good history, and don't be afraid to ask questions too, right? Some people are just not going to think that certain things are important to tell you, so don't be afraid to ask questions to them too. I always like to briefly ask them about any relevant medical history that I need to know. So when I'm considering my treatment and modalities that I'm going to use with them, there are certain things that I would want to know, like do they have a history of cancer, thyroid conditions, heart problems, do they have a pacemaker, any of those kinds of things. What medications are they on, what are they allergic to, etc., etc. So make sure you don't forget about that, because it is important. And then you want to kind of get into the pain section as well. Are they having pain? Most people that you treat will be having some form of pain or numbness or something that you can assess. So ask them for a numeric value or a description, or they can tell you, you can get one of those little visual charts where it shows kind of the faces, and they can tell you that way, or you can ask them mild, medium, severe, kind of find different ways to gauge it, because not every person is the same, so we don't all experience pain the same way. So try and be open to that as much as possible. Ask them where they're feeling the pain, what does it feel like, any descriptions that come to mind, when the pain happens, what makes it better, what makes it worse, etc. Okay, those things are important. And you can do like a little sensory screen at that time too. You can ask them, are you numb, tingling anywhere, are you hypersensitive anywhere, and you can kind of go through that as well. And if they answer yes to anything, or you notice that they feel numb in certain areas, then you may want to go into like some sensory screening or some nerve gliding or nerve tensioners, and you can do that as well. And then you want to start getting into kind of your measurements. So, take range of motion measurements, do like a cervical screen, see if they have full range of motion of their neck and their shoulders. Even if you're treating a trigger finger, right? You want to know what everything looks like from the top of the chain down, because they may have some cervical or shoulder issues that you can't treat. So it's important to know that. You can do strength testing if you feel like it's appropriate. Do some manual muscle testing. I usually do range of motion, and then I'll do like grip and pinch testing, and then from there, if there's any like special tests or manual muscle testing that I need to do based on their diagnosis or the information they've given me so far, then I'll do those provocative maneuvers then, because I find that those are usually the things that provoke the most pain, and so people are like not going to be as willing to do the movements of the range of motion measurements, or potentially do the grip testing if you've already done something that puts them into a lot of pain. So just a secret little tip, try and put those provocative tests kind of at the bottom so that you can get good measurements on everything else first. And I think it's important too that you always assess bilaterally, because obviously even if it's just a one-sided injury, it's important for you to know what their norm is on their other side for both strength, range of motion, and everything else as well. Special testing, obviously, you may not know this yet because you might be a newer grad or you might be just getting into field work, but find someone that can help teach you or kind of try and seek some information about different special tests. Pick a diagnosis, like pick Decker veins, tenosynovitis, right? When you're evaluating those people, you might want to try doing some different testing based on what they show you, right? So you can do kind of like a Finkelstein's maneuver. You can do different manual muscle testing, trying to test the EPB versus EPL, all that kind of stuff. You can do like an Eichhoff's test. I mean, there's tons of different tests out there. So pick a diagnosis, kind of study up on it, search for different diagnostic tests or special tests that you can do to help tease out what's going on with this person. Yeah. So once I've got kind of my basic information gathered, and I can be satisfied with where I'm at in the evaluation process, then what I like to do next is try to get this person out of pain, or try to get their pain to reduce a little bit. So that's when I'm going to use modalities, things like heat. I'm going to put them on heat. I'm going to dip them in the paraffin wax. I'm going to do some ice massage, something that my tech can do for me that shows them that we can relieve their pain. Or I'm going to try some kinesiotaping or something on them that's going to get their pain to come down a little bit. Usually I like to put people on heat first because it feels good, it kind of relaxes them, it gives them a little bit of a break. They can kind of process all the information that they've shared and what I've shared with them so far. But it also gives me a little bit of time to step away from that person, work with another patient if I need to, or check in on one of my other patients, and then come back to them. It just gives me a little bit of like leeway in my timing, so I can always kind of juggle between patients or give my tech some exercises to go through them with, and then I can come back and check in on them a little bit later. But just showing people even a little taste of what you can do and what they're going to get when they come to hand therapy is really helpful. It's going to make people want to come back. It's going to give them just kind of a sense of their expectations of what they can hope to gain with therapy. And I also like to, kind of talk with them about what their expectations are, what they're hoping to gain, what their goals are. Certainly you can set goals for them, but it's important to have them invested in it as well. So asking them, what are they hoping to get out of therapy? And you can kind of discuss what's realistic and what's not. It may not be realistic to have a goal of, no pain ever. It just really depends on the person and the diagnosis, but that's something you can talk with them about. They should know, kind of what to expect from therapy, what they should wear. They shouldn't be wearing things that make it hard for you to access the body part that you're going to be treating, how long they're going to be in the building for, how long their appointments are going to last, what your cancellation policy is. All those kinds of things are important. And you want them to leave with like a sense of confidence in you too, right? So definitely I always give at least something for a home program. Even if I have no idea what to give them, I'm going to give them something, whether that be like trying some different modalities out, or maybe I'm going to give them like some joint protection things, or just a couple different stretches. I give tendon glides a lot, just something that they can do at home to start treating themselves, and then when they come back you can kind of add to the program. I try not to overload people on their first visit because you tend to find that people don't remember what you told them to do. So give them like 2 to 3 exercises is usually kind of the magic number for that first visit, and then you can add to it later once they come back and you've kind of developed a more thorough treatment plan. So that's kind of what I start with in an initial evaluation. Certainly there are tons of ways you can go with it. My this video is not the only way to do things, right? But I know as a new grad and as a student going into my hand therapy fieldwork, it would have been helpful to have somebody kind of explain what a hand therapy evaluation might look like and how to get through it in an appropriate amount of time. So I hope that you guys find this video helpful. Feel free to comment below if you have any other tips or tricks or questions or anything. Happy to answer any questions that you might have or comments or anything like that. Give this video a thumbs up if you enjoyed it. Don't forget to subscribe to the channel, and thank you guys so much for watching.